So you've been diagnosed with gout. Here's what you need to know and a bit of what you might like to know. So gout is a disease that causes inflammation of your joints. Most commonly it causes an inflamed base of your first toe or your big toe. So right at the bottom of the big toe it's red and swollen. Also your knee is likely to be affected, but other joints can be affected too. They say that the pain of gout is such that even if you have a bed sheet lying over your big toe, it's excruciatingly painful. King Henry VIII had gout, if you like history. You might remember that King Henry VIII was quite overweight. He liked very rich foods. He liked alcohol. Those are the types of foods that make gout worse. So avoid alcohol and avoid certain types of rich foods like gravy, wild game, anchovies, scallops, shrimp, and to a lesser extent red meat, pork, poultry, mushrooms, asparagus, cauliflower, and even spinach. All those things can set off your gout, and certainly if you're having a gouty attack now, you want to avoid those things. You also want to drink a lot of fluids to help clean everything out, but not alcohol. We want just water. Drink a lot of water. You may have been given a medication that prevents a future attack, and if you have been, take that as directed because that will help you to avoid having this problem again in future. Now, in the emergency room, we often give a medicine to help take down the inflammation now. That would often be indomethacin or another medicine like it, like ibuprofen, but usually it's indomethacin or something like that. Take that as directed. If you're given colchicine, it can also be very effective, but can give you a lot of nausea and vomiting, so be aware of that. That may happen. Other ways to deal with the inflammation and pain would be just using a frozen bag of peas or some ice wrapped in a towel and placing it on the swollen joint. Leave it on for 15 minutes, take it off, let your skin return to normal temperature, and then try again once your skin returns to normal temperature. For some patients, they find that's quite effective and it's certainly worth trying. It's free and it's not harmful for you to try. As always, see your family doctor if things aren't improving in a few days. Reasons to come back to the emergency room. First of all, if you develop a new fever, that would be 38.0 degrees or 100.4 if you're working in Fahrenheit. If you cannot move your joint at all, so if it was my elbow that had gout, I cannot extend it at all, or the knee, I cannot move it out at all, that would be reason number 2 to come back to the emergency room. And lastly, if you have increasing redness. So the joint is quite red and swollen, but now the redness is spreading. If that happens, that's another reason number 3 to come back to the emergency room. I'm Dr. Atsma, and those are my discharge instructions for gout.